Are you waking up 2, 3, maybe 4 times a night just to use the bathroom? Do you notice that when you finally get there, the stream is weak, slow, or takes forever to start? Gentlemen, your body is trying to tell you something, and most men over 50 are either too embarrassed to listen or simply don't know what to look for. Today, I'm going to walk you through 5 early warning signs of prostate problems that you should never, ever ignore. I'm Dr. Emily Carter, a urologist with 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I've worked with thousands of men who thought their best days were behind them, men who dismissed symptoms for years until a simple conversation in my office changed everything. What I'm sharing today could do the same for you. Before we dive in, hit that like button and drop a comment telling me where you're watching from. It genuinely helps me understand who I'm reaching, and it helps more men like you find this information. Now, let's talk about why this matters so much. The prostate is a small, walnut-sized gland, but don't let the size fool you. It sits directly beneath your bladder and wraps around your urethra, the tube that carries urine out of your body. When something goes wrong with that gland, everything downstream is affected. And here's the part that troubles me most as a physician. Prostate problems are incredibly common in men over 50, yet the majority of men ignore the early signs for months, sometimes years, before seeking help. By then, what could have been a simple, manageable issue becomes far more complicated. The symptoms rob men of their sleep, their confidence, their intimacy, and their quality of life. And for a subset of men, the delay in detection has far more serious consequences. You deserve better than that. Your family deserves better than that. So let's get into it. Warning sign number 1, frequent nighttime urination. From a biological standpoint, this is called nocturia, and it happens because an enlarging prostate compresses the urethra, causing the bladder to work harder and never fully empty. Think of it like a garden hose with someone slowly squeezing the middle. The pressure builds up and the bladder becomes hyperactive, signaling urgency even when it's only partially full. Waking up once during the night can be normal. Waking up 2, 3, or more times is not something to wave off. Emotionally, this one is devastating in ways most men don't talk about. The broken sleep leads to exhaustion, irritability, and brain fog. Men tell me they stop planning trips, stop sharing a bed with their partner, stop feeling like themselves. And practically, here's what you should do. Start tracking your nighttime bathroom visits for 1 week. Write it down. If you're consistently at 2 or more times per night, that information is exactly what your doctor needs to begin an evaluation. Warning sign number 2, a weak or interrupted urine stream. Biologically, this is one of the most telling signs of early prostate enlargement, known medically as benign prostatic hyperplasia, or BPH. As the prostate grows, it tightens around the urethra like a clamp on a pipe. The flow becomes weak, it starts and stops, or it takes an unusually long time to begin. Some men describe it as straining just to urinate. Emotionally, this symptom quietly chips away at a man's sense of vigor. Men often laugh it off at first. Just getting old, they say, but inside they know something isn't right, and that uncertainty is exhausting. Practically, pay attention to your stream every single day. If you notice a consistent change in force or flow, not just once but regularly, that warrants a visit to your urologist. Do not wait for it to get worse. And number 4 is the one most men get completely wrong, so stay with me. Warning sign number 3, a burning sensation or pain during urination. Biologically, this symptom often points toward prostatitis, inflammation of the prostate, which can be caused by bacterial infection or, in many cases, by non-bacterial chronic inflammation. The prostate becomes swollen and irritated, and because it sits so close to the urethra and bladder, that irritation is felt directly as burning or discomfort when you urinate. Emotionally, this symptom tends to create shame and avoidance. Many men assume it must be a sexually transmitted infection and refuse to seek help out of embarrassment. I want to say this clearly. Prostatitis is extremely common. It is not always related to sexual activity, and it is very treatable. You have nothing to be embarrassed about in my office or any physician's office. Let me tell you about Robert, 58, a high school football coach. He came to me after 6 months of burning discomfort that he had told no one, not his wife, not his GP, nobody. He said, "Doctor, I thought I just had to live with it." After a course of targeted treatment and some lifestyle adjustments, 3 months later he told me, "I feel like a completely different man." 6 months of unnecessary suffering, all because of silence. Practically any burning or pain during urination that persists beyond a few days needs to be evaluated. This is not a wait-and-see symptom. Warning sign number 4, difficulty fully emptying the bladder. This is the one most men misread. Biologically, this is called urinary retention, and it happens when the prostate obstruction becomes significant enough that the bladder cannot expel all its contents. You use the bathroom, you walk away, and within minutes you feel like you need to go again. Or you constantly feel a low-level pressure in your lower abdomen. That residual urine sitting in your bladder also becomes a breeding ground for urinary tract infections, something men often don't realize they can get. Emotionally, this symptom creates a kind of low-grade anxiety that follows men everywhere. The constant awareness of your bladder, the mental mapping of every bathroom in every building, the hesitation before long car rides or meetings. It shrinks a man's world quietly and gradually. Practically, there is a simple test your urologist can perform called a post-void residual ultrasound. It measures exactly how much urine remains in your bladder after urination. It is painless, quick, and enormously informative. Ask for it by name. Warning sign number 5, blood in the urine or semen. I want to address this one with complete calm and complete seriousness. Biologically, the presence of blood, whether visible or detected through a urine test, is called hematuria. And while it can have benign causes, including prostate inflammation or enlarged blood vessels around the prostate, it is a symptom that must always be evaluated without delay. The same applies to blood in the semen. These symptoms do not automatically mean something catastrophic is happening, but they are your body sending an urgent signal that deserves an urgent response. Emotionally, I understand that seeing blood where you don't expect it is alarming. Some men panic. Others, strangely, avoid the doctor precisely because they are afraid of what they might hear. I want to say gently but firmly, the fear of a diagnosis is never a reason to delay one. Early detection saves lives. That is not a slogan. It is a medical fact I have witnessed firsthand. Practically, if you see blood in your urine or semen even once, call your doctor that same day or go to an urgent care clinic. Do not wait for it to happen again. Here is your simple action plan. Step 1. For the next 7 days, pay conscious attention to your urinary habits. Frequency, stream strength, any discomfort, any unusual appearance. Write it down. Step 2. If you recognize 2 or more of the signs discussed today, schedule an appointment with a urologist specifically, not just your general practitioner. Ask for a PSA blood test and a digital rectal exam. These are the foundational tools for prostate health screening. Step 3. Share this video with one man in your life over 50. Your brother, your friend, your father. You may genuinely be giving them a gift they don't know they need. Gentlemen, if you've been frustrated, embarrassed, or quietly worried about any of these symptoms, I want you to hear this. You are not broken. You are not simply getting old and expected to suffer in silence. Your body is communicating with you, and that communication is a strength, not a weakness. Men who catch these signs early have outstanding outcomes. The prostate responds well to treatment when problems are addressed in their early stages. Even after 60, even after years of ignoring symptoms, restoration is possible. Vitality is possible. It is never too late to take your health seriously. If this video helped you, please like it. Leave a comment below telling me which warning sign surprised you most. Share it with a man in your life who needs to hear this. And subscribe for weekly content dedicated to men's health after 50. I'm Dr. Emily Carter, reminding you that after 50, vitality isn't lost. It's waiting to be awakened. Take care, and I'll see you in the next one.